But one thing for sure is what we've seen from the pandemic is two different kinds of people. Those who were really active before the pandemic, during the pandemic, shut down and did nothing, and now they're on this trajectory to suddenly think they can bounce back to where they were. Then we have this other group of people who weren't particularly active before the pandemic, but have seen the pandemic as an opportunity to learn and want to try new things and take a little better care of themselves, who are sort of starting fresh. So thinking about all of those kinds of people who are now trying to do a little bit more, what kind of advice do you have for them, Dave?
Yeah, thanks, Michelle. It's a great question. I'm looking forward to hearing from all these great experts you have lined up as well, because we're hearing this from people in the community and we're experiencing it ourselves, including myself. My wife and I were in that group that said we got to get moving, and we got a treadmill and we got a Peloton recently, so we're absolutely hopping on that train. And yet we're seeing this in our clinics too, right? So people aren't just feeling it out there, we're seeing it in our clinics. Our therapists are experiencing it. One really interesting fact that absolutely jumps off the table at you is one study found that people probably gained an average of 1.5 pounds per month during the lockdown period. So that's so significant. And that level of inactivity, that weight gain, was for a lot of reasons, right? We're inactive, we're stressed, and it affects our physical health and it affects our mental health. And we've now started to see the changes happen as the sun's out, everybody's feeling a little bit better. But as you said, some folks are ramping up a little too quickly or simply looking for advice on a way forward. So I think this is a perfect, timely topic.
Yeah. So for those people who may have put on a little bit of extra poundage, you've obviously got to be mindful of your diet and nutrition. We won't get too much into that today. We'll focus a little bit more on movement. So what are some overall guidelines about how much someone should expect from their body? How much is enough, but not too much? Maybe that's the better question.
Yeah, perfect. I think we can talk about the goal, but then talk about the way to get there, because everybody's going to be starting in a different place. So the goal is 30 minutes of physical activity, especially aerobic activity. So we're talking get your heart rate up a little bit, get the blood flowing, cardio type exercises. Shoot for 30 minutes of activity at least 4 or 5 days a week. That's just a really good recommendation for everyone for optimal health. But I find it really important to emphasize that starting small is perfectly fine for people. 10 minutes a day, you're still actually going to get all the positive effects that people talk about, which is feeling better, sleeping a little bit better, starting to lose a little bit of weight. 10 minutes a day is a perfect way to start, especially for somebody who's not sure where to start or doesn't know how quickly to ramp up.
So